Okay, first thing we have are the E1 techniques for the hip. Okay, Angela, just gonna straighten your legs here. First one is the long axis distraction. So first thing you do is you get them into a loose pack position of 30 degrees flexion, at 30 degrees abduction, slight external rotation. I would have a helper stabilize the ASIS to keep the patient in place, and that way I can fully and accurately distract the hip. So grab above the malleoli, get in a good stance, tuck my elbows, kind of bunch up the skin first, and then while they're stabilizing, I pull back, apply my distraction. And just use your grades accordingly. You can also use a thrust technique for this. So same thing, you get the person to stabilize, and you're right here, and you apply a quick posterior and superficial force. Something like that. And next one, lateral stretch. So there's two variations to this. One is where the knee and hip are flexed. So if I can have you just bring your knee to your chest, right there. Okay. Okay, and remind me if this is correct. So it's okay. Slide my hand down to your. There we go. Or is that the patient for permission? Is it? That's the right there. Okay. Never mind. Stay corrected. So here and here. Yeah. So get into your stance. And then. Yeah. Okay. Thank you. And then. Yeah, the inferior glide of the femoral head. By the way, what I just did were all joint plays, so this should help with all classical motions. So next one is going to be an inferior glide. So I'm going to have you flex your knees, my hand. There you go. And I'll raise the table up a little bit. That way I can get my shoulder right under his knee pit. I'm going to have you turn face me. Okay, can you go and slide my hands down to your part of your feet? There you go. And then I'll tuck your fingers. I'll just take that. Right. So that's straight inferior. If I want to improve flexion and abduction, then what I would do is do a inferior medial stretch. So what I'll do is I'll place my hand right here. The other one is parallel to it. And same thing, I'm just going to push in right there. Okay? And if I want to improve flexion and adduction, I'm going to do an inferior lateral stretch. So I'm kind of angling my force this way. Okay. All right. And then other one is a component motion for flexion and internal rotation, and that is a posterior stretch. So kind of prepare in the same way. Go and bring your knee into my hand. There you go, and then we have kind of a makeshift towel. Like that. What I should have done first is actually place this under here. Actually, you know what? I'm going to do it on the opposite one because I remember I reach over. Okay. Okay, so same thing, flex the knee to the hip. Okay. And then this one's kind of right there. Yeah. Where's it on the table? And there we go. So it's here, I'm going to put them into slight adduction. Right there, and then I'm going to kind of cut my arms down and then push straight down to the joint capsule. There. Okay, and this is a movement to help with flexion and internal rotation. Now, if they have trouble flexing their hip to 90 degrees, there's another version you can do, which is where, gotta think about this. Yep. All you're doing is picking this leg up right here and then place them around the ASIS. Then you're pushing down, or just the proximal femur. Okay, so right under the ASIS. Same thing, you kind of lean over, make sure you got a good hold of this, and then you're just gonna push that leg down. Feel okay? Feel stretch? Where at? Perfect. Okay, and lastly, we have anterior stretch. There's two versions of this, one in prone, one in supine. So, I'll show you the one in supine first. So, if I can remember how to set this up. What you're doing? Anterior stretch in supine. So is it like where you? No, it's not it. It's supine. Yeah. Oh, you're reaching across. That's right. Okay, so you're standing on the same side hip.
For acute.
What's that?
For acute,
Yeah.
both hands. So minimal.
Okay, both hands. So, oh, just like that.
So
Oh.
just push it down.
Easy enough. So one hand kind of near the ASIS, one on the distal femur,
Or proximal.
or more proximal. Okay,
You just can't pick it up.
gotcha. All right. And then you just
This one not too much pressure because it's for acute cases.
okay. So it's like right there. Okay. So pretty minimal pressure. This should help with extension and external rotation. And then lastly, the version in prone. Now I might place this. Okay, go and lie flat for me. So I'm watching his back to make sure he doesn't go into extreme lordosis as I flex his knee. Right about there where I start to feel like he's kind of arching a little bit. So I'm gonna stop at this position. I'm gonna bring him right here, and then I'm gonna place this hand right under the gluteal fold near the ischial tuberosity. And I'm gonna kind of hold this one up and then push down here. Okay? There. And that's another version of anterior stretch.